Welcome to Queer News Tonight, the world's first and only LGBTQ plus daily evening news. It's time to queer up the news. I'm your anchor at Queer News Tonight, Al Ferguson. This evening, we bring you the news of and a perspective representing the LGBTQ plus community from South Florida, America, and across our planet. It's 8 p.m. Tuesday, October 5th, and we are literally out of the closet and into the headlines. So many of your important stories we are going to tell this evening on Queer News Tonight.
This is the world's first live daily LGBTQ evening news show, literally out of the closet and into the headlines on Queer News Tonight with Al Ferguson.
Thank you for joining this special broadcast of Queer News Tonight. This is the world's first and only unedited live LGBTQ plus evening news show. I am LGBTQ ally Ted Deutsch, serving South Florida in the U.S. House of Representatives in Florida's 22nd Congressional District.
Tonight, we partner with AHF, the AIDS Health Foundation, for tonight's VOW campaign, a global advocacy campaign to remind political and public health leaders at the federal level to continue to have the U.S. swiftly share its unused vaccine supply abroad and to honor the millions of individuals that have lost their life to COVID-related causes.
Tonight's broadcast will feature a moving candlelight prayer vigil in support of global vaccine sharing. Happening Out television network and Hotspots magazine and the entire LGBTQ plus community has been dramatically affected by the COVID-19 pandemic. Queer News Tonight and It's Happening Out lost one of its lead anchors early in the coronavirus pandemic. Watch this.
And it's 7 p.m. Monday, April 27th, 2020. We have very difficult news to begin our broadcast of Q News Tonight. With more than 1 million infections now of COVID-19 virus and approaching 58,000 deaths, coronavirus again hits Happening Out television network. We are very sad to report that our It's Happening Out host, Ron Bernensky, has passed away this morning from coronavirus. This morning, after more than a month-long battle with coronavirus, Ron passed. He has been in ICU at Miami Palmetto Hospital here in South Florida on a respirator and a medically induced coma for most of his hospitalization. Every Tuesday night since early in the COVID-19 crisis, Queer News Tonight has held a live Q&A for the LGBTQ plus community with the former National Executive Director of the American Academy of HIV Medicine, Dr. Howard Grossman. It has been designed to inform and educate our LGBTQ plus community on their health needs during pandemic. Hundreds of questions have been asked by viewers. Here's a sample. Watch this.
Well, next question for you, Dr. Grossman. There was a vigil this evening in Orlando to honor the 50,000 Floridians who have died to COVID. Do you think events like this help people realize how important it is to get vaccinated?
They hurt, but truthfully, I think those events really are speaking to the converted. The people who show up at those things are going to be people who believe in science, believe in the vaccine, believe that we can stop this together. And the other people just ignore it.
Queer News Tonight has reported on the COVID-19 effects on the South Florida and American LGBTQ plus community on every news broadcast since January 6, 2020. This week, we reported the news of an estimated 50,000 LGBTQ plus Americans who have lost their lives to COVID-19. Here's the daily reporting on cases, deaths, and vaccines. Watch this.
Queer News Tonight has reported on coronavirus on every news broadcast since January 6, 2020. And tonight we report that as of today, more than 3,117,000 LGBTQ plus Americans have contracted COVID-19.
Queer News Tonight remembers the more than 50,000 LGBTQ plus Americans that have died from coronavirus.
But the news is improving because as of today, more than 396 million vaccination doses have been administered in the United States.
Well, tonight we report on the candlelight vigil happening here in South Florida to honor victims of COVID-19 and to support global COVID-19 vax sharing. U.S. Congressman Ted Deutsch will join South Florida local activists in this event to remember the more than 700,000 Americans and 4.6 million worldwide that have died of coronavirus. To honor this moment, the vigil will include international health ministers, Ebony Crispin, AHF Legislative Affairs and Community Engagement Manager, Reverend Dr. Darrell Watkins, and Reverend Dr. Robert Griffin of Sunshine Cathedral, the world's largest queer church. Also joining the vigil will be Dr. Michael Wolfeller, AHF Chief of Medicine, and many more.
Tonight's vigil will also embrace Vaccinate Our World. Participants will speak out in this live event broadcast in support of the U.S. government continuing to share its surplus COVID-19 vaccine supply with hard-hit countries and those without access to vaccines around the globe.
The vigil follows recent remarks by President Biden addressing the UN General Assembly in New York on global COVID vaccine access and shortages. At a point where nearly 4.7 million people worldwide have died from coronavirus, 57% of the world population have yet to receive any single dose of COVID-19 vaccine.
Tonight's gathering is a part of AHF's VOW campaign, a global advocacy campaign to continue to have the U.S. swiftly share its unused vaccine supply abroad and to honor the millions of individuals who have lost their lives to COVID-related causes.
Michael Weinstein, president of AHF, said, quote, "The world is still on fire. The United States government must share its surplus COVID-19 vaccine doses with middle and low-income countries immediately. None of us are safe until we defeat the pandemic everywhere. Vulnerable people should be protected wherever they live. If the U.S. doesn't increase the access of vaccines to all countries, this pandemic could stretch for years, possibly mutating into even more deadly strains of the virus," end quote.
Wealthy countries have secured enough COVID-19 vaccine doses to vaccinate their entire populations almost 3 times over, leaving many poorer countries struggling to vaccinate even their most vulnerable. Right now, over 60% of the world's population live in countries that won't see widespread vaccine coverage until 2022 or even later, allowing the virus to continue to mutate and extending the lifespan of this pandemic. This vaccine hoarding will prolong the pandemic for everyone and will be a drag on the global economy.
Ebony Crispin, AHF's Manager of Legislative Affairs and Community Engagement, said, quote, "Vaccine apartheid cannot stand. While we applaud the Biden administration for supporting waiving patient rights and to the beginning to create access to vaccination in underserved countries, there is still more work needing to be done. Vaccine is needed immediately around the globe and time continues to be of the essence. We cannot celebrate COVID subsiding here while a strategic plan to ensure COVID vaccination is accessible in every corner of the globe is still not in place," end quote.
As of October 3rd, 6 billion vaccine doses have been administered worldwide. 81% were given in wealthy countries, while low-income countries received only 0.3%, according to the World Health Organization.
Queer News Tonight reports on the importance of COVID-19 pandemic and vaccines in both the LGBTQ South Florida community and across our planet. Well, Congressman Deutsch, your participation tonight in this vigil, it must be a somber moment to think that we've crossed with 50,000 LGBT Americans lost and 700,000 Americans. It must be breathtaking.
This is a really important opportunity for the community to come together and acknowledge that loss and grieve that loss. I just got back from Washington, where there are over 700,000 flags white flags out on the mall, one for each of the lives lost. It is breathtaking to see the expanse of flags and to understand how significantly this loss will be felt in our country for years to come.
We have a unique opportunity, and by the way, thank you for anchoring here tonight at Queer News Tonight. We love our allies. We have a unique opportunity from your perspective to kind of explore and explain to the LGBTQ community where do you think we are in terms of vaccination, and what are you seeing from your position of where we're going in controlling and coming out of the pandemic in the United States?
Well, we're in South Florida. The numbers are definitely better now than they were a few weeks ago. That's encouraging, but we can't let up. And we know that we have a tool that can help literally stop people from getting sick, stop them from going to the hospital, stop them from dying, and ultimately shut down the pandemic. And that's a vaccine. And so we've got to continue to impress upon people why it's so important to get vaccinated, why it's not only in their own interest, but it benefits everyone in their lives as well. That's going to be an important part, I hope, of tonight's event.
We continue to report at Queer News Tonight. Studies and surveys are showing that LGBTQ community are showing vaccination rates in the low 90s, 92%. We have been reporting on. Is that encouraging to you that other segments of the American population are going to eventually fall in line with the vaccines? Are you still pessimistic that we're not going to get there?
Well, I'm still hopeful. I certainly do. I wish that every community in the country had a better than 90% vaccination rate? You bet I do. We would be so much better off if that were the case. I applaud the LGBTQ plus community for understanding the importance of stepping up and getting vaccinated and staying safe, and that's what we're trying to help everyone understand. And there's still some communities in some parts of the country, especially where it's just harder to get the message through, but we have to continue to make the case.
And likewise, in these communities that we're not getting the message through, it has the potential of mutation and then really adversely affecting us. What happens in Mississippi really affects us here in South Florida, eventually, potentially, in this. How do we reach out to these other communities to convince them that the vaccine is just really critically important? Is there any particular thing that we're missing that we're not doing?
Well, if there were, and if you think of it, I'd like to know.
It's a tough problem.
But look, I think the one thing that we can do is to just keep talking about the importance. Try to turn down the political rhetoric and help people focus on the fact that this is life-saving. And in a lot of these communities, young, healthy people have wound up in the emergency rooms and didn't come home. And that hopefully is convincing people they need to do this. In
our conversations at Queer News Tonight, we constantly come back to the fact that we believe that one of the reasons the LGBTQ community is among the leading numbers in vaccination is we believe in science. And so the embracement, we don't reject health and science news, and it's something that we continue to must talk about.
Right. So, something that we should all, I think, safe to say we should all believe in science.
Exactly.
That doesn't seem like too bold of a statement.
Before we get ready to go to the vigil, I want to just take a moment about AHF's vac sharing positions. Tell us a little bit about what you think about what's going on in vaccination sharing and the amount of access around the world.
Well, even just now we were talking about what happens in another state and its impact on South Florida. That's true not just state to state, but we can't ignore what's happening around the rest of the world, because the longer that this goes on, the greater the chance that there are mutations and that those mutations travel, especially here in South Florida, where people visit literally from all across the world. We've got to do our part to help make sure that people in in other countries around the world can be vaccinated as well. It's in our interest. It's going to help stop this pandemic once and for all.
Yeah. Well, we appreciate you being here at Core News
Thanks.
tonight and anchoring tonight. We're going to have you back because there's a few things that are going on in Washington that you're directly addressing that
there
we'd
are a
like
few.
to talk about.
Anytime.
Exactly, for the LGBTQ community. All right. Well, more information about AHF's Vaccinate Our World program can be seen at their website, vaccinateourworld.org. We are now going to take you to Sunshine Cathedral in Fort Lauderdale, Florida, to remember those lost to COVID-19 and to remind us all what we are fighting for. Watch this.
Hello, everyone. Thank you so much for being here today. My name is Ebony Crispin. I am the Legislative Affairs and Community Engagement Manager for AIDS Healthcare Foundation. I'm here in that capacity because I'm very passionate about the work that the organization does, both here locally and globally. But I'm here because I was asked many months ago for the team to get together and organize here locally a vigil that can acknowledge the people that have lost their life to COVID. Because unfortunately, this virus has been largely politicized, as so many things in our nation has. I think it is easy for all of us, I'll speak for myself, when I say that we can gloss over the deaths, the loss, the sadness that has taken place over the course of the last year and a half. I think we're all still getting our breath. I think it'll take time for that to really take place. But as I think about the time we're in right now and the people that I know that have lost their life or have spent months recovering from COVID, I think it's so important for us to take a moment at least just for a moment, to put down political differences and really think about what this virus has done to us. Even if you haven't been affected by it negatively, why we have to think about putting our masks on, social distancing, who we talk to, how we engage with people if they simply sneeze or cough. But also think about those who have lost a parent, a sibling, a neighbor, and what that does to us in a way that is startling, in particular because unfortunately or fortunately life goes on. And there's a sadness to that I think that should be acknowledged. And so I really appreciate all of you taking time, at least for a few moments, to be here with us today. There'll be a couple of people that will say a few words. We'll have a moment of silence towards the end. And then unfortunately or fortunately, life goes on. So thank you so much. I first want to bring up a friend of mine. I'll let her tell her story. But I asked her to speak today because she has been deeply affected by COVID. Her name is Tricia Fletcher. Please come up, Tricia.
Thank you, Ebony, for letting me share my story this evening. You're gonna have to give me a minute to kind of get through it first. This is my mom. And that's who I'm going to be talking about today. On January 17th, 2021, I lost not only my mom, Margaret Price Talley, but my best friend, confidant, mentor, my shoulder to cry on, my cheerleader, my words of wisdom, my unconditional love, my ride or die, my everything. Those who knew my mom, Margaret Price Talley, knew of her thoughtfulness, generosity, loving smile, and her hugs were so welcoming. That was my mom. To my mom, Margaret Price Talley, her family always came first, and she would be there to support my sister and I as well as her brothers, sisters, nieces, and nephews, everyone. My mom, Margaret Price Talley, never missed a birthday, holiday, or special event. My mom was always there with gifts, cards, and words of wisdom to commemorate the occasion. This was her way. My mom, Margaret Price Talley, she also loved to shop and to find unique items, clothes, jewelry, and accessories that she would share with others. I'm actually, wearing some of her bracelets that she left with us. She was a breast cancer survivor, so she has all the breast cancer bracelets, and this is, October. My mom also loved to read, travel, cruise. She really liked to cruise, and crochet and spend time with family. My sister, along with her grandchildren, have a handmade crocheted blanket to cherish our mom's or her grandmom's honor. But on January 17th, 2021, a week before her scheduled vaccination and 2 days before her 71st birthday, our life changed forever. Since COVID-19 became a household name, my mom was fearful, always practicing appropriate precautions. But not everyone was as fearful as she, and not everyone practiced those same precautions. My mom would always tell us after we would say, "I love you," she would say, "I love you more." Even in a text message, she would say, "I love you more," and add the kissing emoji. My shirt today that I'm wearing says, "I love you more," with the kissing emoji, my mom's initials, and her passing date. I say today, love your family, friends, and community members more. Wear your mask and get vaccinated. It saves lives. Thank you.
Thank you so much, Tricia. I want to just acknowledge a couple of folks before I move on. Before we bring up to the podium Commissioner Holness, I do want to acknowledge some people that took time today, organizations that we work closely with, including Latino Salud, SunServe, World AIDS Museum, Save.LGBT, Equality Florida, and Aqua Foundation. I really appreciate also the Pride Center, and really, from the bottom of my heart, thank you not just for today, but always being in partnership with us so that we can do the work that we need to do in order to support many different causes, everything from healthcare to housing. Nothing is done in a bubble, as we know, and so I really appreciate the time that each organization takes when I email you or text or call and say, "Hey, Christopher, Orlando, Grace, Dr. Lopes, I need you to be here." So thank you so much. I know these kind of causes are as important to you as it is to us. I do want to bring Commissioner Dale Holness up to say a few words about COVID-19 and those that have lost their life to this disease. Thank you.
Thank you very much, and thanks for the invitation to be here with you. The one thing that COVID has taught all of us, or we should have learned and know by now, if we didn't before, is that as human beings, we're connected. This tiny virus that can't be seen by our eyes naturally started in Wuhan, China, and spread to every corner of the earth because humans are connected. So we're all in this together. And as a part of my efforts in 2020 whilst I was mayor, was to bring us together And I can tell you at the onset of the virus pandemic, we didn't know really what to do. We were a bit confused. And there were some mayors who wanted to go one way, some cities who wanted to go another way. But I was able to bring us all together. And though we didn't always agree on exactly the strategy going forward, we were able to form consensus as a community, as a people, to combat this virus. And we did a weekly meeting with all the mayors across Broward County. And there was some real strong discussion as to what we should or shouldn't do. But we relied on Dr. Paula Tashi primarily. She's the person in charge of Broward Health, the Florida Department of Health department here in Broward County. And we look at the data. We look at the facts. And we use that to determine what we do. And yes, we shut down for a little while by ordering a stay at home. We put some curfews in. It was painful for us because we understand that we need to protect lives. At the same time, we need to ensure people have a livelihood. Broward County actually fared better per capita in terms of lives lost compared to Palm Beach or Miami-Dade County. And in fact, Palm Beach had more deaths than Broward did, even though they're a smaller population than us. So I'm so grateful that you gathered here this afternoon to discuss and deal with this issue, to have this vigil, to ensure that we're doing everything we can to stop the spread of this deadly disease. We've combated diseases over time in the world, and we've worked together to eliminate them in many instances. Polio is not something you hear about commonly anymore. And folks says, well, I don't want to be mandated to take vaccination. If it wasn't mandated, and not just in this country, around the world. You know, I was born in Jamaica. I had to go get my polio shots and all my other shots before I could go to school, similarly here. And it has saved us from these other deadly diseases. We know for sure that the vaccination saves lives. So everyone should get the vaccination. I got mine, first shot in January this year. And I got it because I was running a pop-up at Mount Hermon AME Church. We got a lot of seniors to come in. I didn't reach the age yet to get the shot, but we had about 7 shots left over at the end of the day. We wouldn't waste it, so one went in my arm. I'm about ready to go get the booster because it's essential that we do this. And something else is in recent time we've dealt with, HIV/AIDS. I've sit on the HIV Planning Council since I got elected. Really no one else want to be on that planning council. Yet the work is so well managed by the volunteers and all the organizations that have come together. And look at what we have now. What was once a death sentence, no longer so. It can be managed because we as humans found a way to destigmatize and to ensure that we brought the resources together to save lives. We must continue to do that through this pandemic, and you will be the leaders who are out on the front line, ensuring that what needs to be done is done. I have a nephew who is an announcer on a radio station, 34 years old, was quite overweight, didn't want to take the vaccine. He ended up in the hospital for almost a month. Barely surviving. They had to induce coma so that he would stay calm, so that the treatment could occur. He's out, lost quite a bit of weight. Now he's ready to go on the road with me to make sure young people understand the importance of doing this. And we want to make it as convenient as possible. The vaccination is available practically anywhere you need to get it. We send out in my newsletter, if any of you receive my newsletter, you'll have gotten updates on where to go ever since the pandemic hit. We continue to put information out on that. If you need to get an update from me, you can send an email to dwholeness@broward.org, and we'll put you in our email database that we send stuff out to on a regular basis. Again, as we mourn the loss of so many dear loved ones, let us all band together and ensure that we are doing everything we can to end the spread of this deadly virus, because we can. Thank you so much.
Thank you so much, Commissioner Holness. Next, a few words from the Reverend from Sunshine Cathedral, Reverend Griffin. Thank you.
Thank you, Ebony. She said a few words, but I come from a Baptist tradition, so bear with me. It is a pleasure for me to welcome you here this evening to the Sunshine Cathedral on the Sunshine Cathedral Square. Whether you're in the room or you're joining us online, we've gathered this evening for something that's very dear to all of our hearts on some level. Globally, so many have not been impacted by the coronavirus, and yet we still have days to come that we have to deal with this particular virus. You're looking at someone who tested HIV positive back in 1987. So when I think about testing positive in 1987 and what all that disease carried with it, there was a lot of correlation for me around the coronavirus as it began to come out and how that impacted people in their lives. The no touching, the no being around, family members dropping people off at the emergency rooms and not being able to go in and never seeing them come back out again. Working with local funeral homes to help family members find a way to mourn the loss of those they had lost. And this church, this cathedral, Sunshine Cathedral, was one of the few churches in the area that last year would open up for funeral homes to bring their friends and family in to say goodbye to their loved ones, because a lot of churches would not open up their doors. So there's a lot of correlation between the HIV for me and the coronavirus, and one thing that sustained me through that virus and this one is hope. And that we as a community, we as a nation, and we as a world must always cling to hope and must always remember those who've gone on before us, that we never forget them and the impact that they made on our lives. Thank you.
Thank you so much. So we have a few more people who are going to say a few words, but I did want to just acknowledge that one of the reasons why we are organizing and mobilizing the way we are today is because while we are seeing the vaccine be accessible to people in countries across the world, we do not have nearly as many vaccines as we need to in countries that are close to family and friends that live here in South Florida. And so I want to just acknowledge that and share that the work that we do at AHF and many organizations across the country are working together in order to ensure that for those that can, are able, and want to take the vaccine will have access to them. And that's part of the work today, is to honor those that we have lost while ensuring that people who can and are able to take the vaccine have the ability to do so. I had the pleasure of meeting this next guest a couple of years ago when I spoke at a roundtable that he did here in Fort Lauderdale at Broward College. I don't know him personally, but always just the kindest man. And I am, like so many people, skeptical of politicians. But I have had the opportunity to speak to him, and just a very kind, dear, and authentic man. And so I was so grateful when his staff said, you know, we'll do everything we can to get him here today. So thank you so much. And without further ado, I'm grateful to introduce and have you hear a little bit from U.S. Congressman Ted Deutsch.
Ebony, thank you very much. It's a really nice introduction. Reverend, I am I'm struck by your words and the straight line between HIV/AIDS and the way the community has dealt with, confronted over years HIV/AIDS, the straight line to COVID, and the connecting line being hope. I'm really encouraged by that. And I know, Trisha, I'm so sorry for your loss of your mom, who sounds as special and unique as I know she was to you. I'm grateful that you share that with us so that we can also feel your loss as we mourn with you and Reverend Commissioner Holness. I haven't, I just got back from Washington. I haven't spent a lot of time in places of worship over the past 18 months because there haven't been a lot of opportunities, and often they were closed, and it's really good to be here together. And I thank AHF, I thank all of you for being here. I was in Washington, where I think most of us have probably seen by now the memorial on the mall. Over 20 acres on the mall, there are over 700,000 flags, white flags. And we went from those early days of the pandemic where every loss was mourned over the course of now more than a year and a half, where the numbers have become so staggering that it really took an exhibit like that, the magnitude of looking out over a field of flags representing a field of lost souls, that moments like this are so important. We've spent this whole pandemic trying to keep safe, trying to prevent common sense decisions from becoming political, trying to make sure that we were listening to the good advice we were given to wear a mask and to get vaccinated and to stay safe. And still 700,000 Americans, over 55,000 of our neighbors in Florida, lost their lives to this awful, awful disease. And the one thing, and everyone has really alluded to this in one way or another, and Commissioner Holness especially, the one thing that we all learned, what we have learned, what we've been reminded of, is the role that we play, not just for ourselves and for our family, but the role that we play in our community and the way that our lives touch the lives of others. And if anything coming through this, if we're not reminded, if we haven't learned once and for all the need for us to do everything we can to ensure that everyone has access to the care they need if they get sick, that everyone has access to the vaccines that they need to keep them safe. If we haven't come through this with a deeper appreciation for our frontline medical workers, our doctors and nurses and techs and the people who literally before there was a vaccine put themselves in harm's way, risked their lives day after day after day to keep our community safe. And if we haven't, after all of this, recognized the important role that we play in helping to make sure that the people who can't work don't go hungry, and the people who have lost a job have a place to turn, and the people who are suffering can be lifted up by us. If we haven't learned all of those things through this pandemic, then we've learned nothing at all. And I maintain that when we get through this, as awful as this has been, as much loss as there's been, as much as there is to mourn, and as important as moments like this are, we need to be reminded of who we are as a community, who we are for one another, and as we move forward from this time, to recall the lives lost and to recall the lives touched by so many throughout this pandemic. I'm grateful, really grateful for the opportunity to spend some time here thinking about all of these issues, but mostly thinking about the people that we've lost over the course of this pandemic, and recognizing that we will always remember them and we will honor their memory, every one of them, your mother, Tricia, and every one of them. We will honor their memory by being good and decent and kind and helpful to one another, and being there as part of a community that cares so deeply for one another. So I'm really grateful. Thanks so much for having me.
Okay, so there are a couple of folks that were due to speak today, and so as I was sitting down just now, I was thinking, well, how am I going to stretch this program long enough for them to get here? And I don't know whether I'll be able to do that or not. So if they don't come in the next 30 seconds, then we're going to hear from our last speaker who is here. I did want to say two quick things. So if you'd like to be a part of the coalition that we are working to build, to support educating people about the vaccine, supporting those who are interested in getting vaccinated, as well as the work that's necessary in order to ensure that all countries have the same access to the vaccination as we do here in the States. Please feel free to reach out to us. I'm here locally in Fort Lauderdale. You can Google my name or AIDS Healthcare Foundation. If you call our headquarters, they will direct you to me and the work that we are doing in partnership with a lot of organizations, including the University of Miami. And I want to acknowledge them because we have worked tirelessly over the last couple of months to figure out ways to be able to support some of those efforts. And so I am going to go ahead and ask the lead minister here at Sunshine Cathedral to come up and say a few words, and also we'll do a moment of silence at the very end. And before we do that, Commissioner Sorensen just walked in, and he was the person I was waiting for. Your timing is impeccable, Commissioner. If you can come on up and say a few words, underscore few, and then we will hear from the lead minister. Thank you so much. Please.
Thank you so much, Ebony, and elected representatives and clergy. Thank you for having me, and thank you all for being here and celebrating and lifting up those who have sacrificed, those who have been harmed, and those who have died as a result. I know we've all lost someone or family member or friend, and I'm so grateful for our community for coming together in difficult times like these and leading with facts and leading with compassion and leading with the idea that even in difficult times we can all strive together. And I just look forward to brighter days, and that all those who have passed be a blessing to each of us and a reminder of the gift of life and the joy of being together. So I thank you, Ebony, for your coordination, and I'll keep it brief and stop there. Thank you.
Okay. And without further ado, I welcome to the podium and grateful for you opening the church today for us to be able to do this. I, on behalf of AIDS Healthcare Foundation, Mike Kane, and the entire staff, thank you so much for being here so that we can take a few moments to pay homage to those that lost their life. And without further ado, Reverend Dr. Darrell Watkins.
Well, thank you. You said you I didn't know how you were going to stretch. Well, I'm always ready to come to the rescue. So don't worry, honey, I got you. Don't worry about that. In fact, my husband of 21 years, he carries the hook. He's supposed to pull me away if I go on too long. He talked about being HIV positive since the 80s. I am since 91. And then we spent the last few decades together. And sharing my life with him is the great joy of my life. That I get to spend my life with the love of my life and do the work that I love, the work that I feel called to do with him. I just have a charmed life. And when we were all on lockdown and we couldn't get out and there was nowhere to get out to anyway, I didn't feel the loneliness that so many people felt because I was on lockdown with the person I never get enough of anyway. So I didn't have to share him for about 18 months with the community and with the world. And as much of a blessing as that was to me, I became very aware pretty soon that that was a rare blessing and that some people were very sad and very afraid and very lonely. I have a friend who lost her mother during that time, and her mother was in the hospital, and only one person could see her. That was the hospital rules. And so they decided that the sister who lived closer could be the one. And my friend had to say goodbye to her mother by Skype, had to do it FaceTime. And they lost the connection. And she had to do it again. So she didn't get to be with her mother. She had to say goodbye to her mother through technology, and in the midst of doing that, got lost and had to do it all over again, had to say those heart-wrenching things again. So this has been a very difficult time. And here we are, though. We're still doing what we can. We're still hoping. We're still praying. We're still working. We're still volunteering. We're still telling our stories. And I'm so glad that Sunshine could be a place where that happens. So we've heard kind words from political leaders. We've heard a heart-wrenching story from someone who has faced the pandemic personally and at great cost. We've all been doing the work and we've lost loved ones. So now it's time for a moment of prayer, the benediction. Benediction means good word, and spiritual and religious services often end with a benediction, with a good word. And it's usually a prayer. But I feel like I'm just ending the prayer, not starting it. When you decided to come here, that was part of a prayer. When you showed up, that was part of a prayer. When you've done your work, when you've made your donations, when you've volunteered your time, when you've said your good wishes, when you've encouraged someone, that's all been part of the prayer. And so this is just another moment of the ongoing prayer. And so in the name of all that we call good, let us lift up our hearts. For those who share their stories, we are thankful. For human resilience, we are thankful. For indomitable hope, we are thankful. For technologies that reduced our loneliness, we are thankful. For masks and vaccines, we are thankful. For medical breakthroughs and medical personnel, we are thankful. For survivors, we are thankful. For healing that emerges from grief, we are thankful. And for the departed, we give thanks for their lives and for our blessed memories of them. Now, for the departed and for those who continue to navigate the pandemic, let us light our candles of memory and hope. Let us rise as we are able to stand with and for those who struggle and those who have lost the struggle. And let us observe a moment of sacred silence. May healing flow throughout the world. Amen.
Safe travels home. Thank you so much for being here today. I think that there is one more announcement. No? Okay. So thank you so much. I really appreciate your time. Be well. Thank you.
Thank you so much.